Good evening, everyone, and welcome along to the PANS Pandas UK Youth Advisory Board Ask the Experts webinar. We're all very excited to have you all here this evening. We've got a wonderful panel of experts for you to answer all your burning questions and some wonderful questions we've had so far. It's been excellent. I'm Mitch. I'll be your chair for this evening. I'm 21 years old. And I've been a member of the Youth Advisory Board for quite a few years now. The Youth Advisory Board is a group of young people aged between 8 and 25 who work very closely with the PANS Pandas UK charity to drive the direction of change that we'd like to see as those who've experienced it ourselves. This panel is about asking the most important questions to you at home and getting both experts and experts by experience, people like me, getting their opinions, getting their past experiences and everything they know to help guide our problems, our future, and everything we want to know. So I'm going to hand over to our panelists to introduce themselves for you now. We're going to start with Tilda. So Tilda, if you'd like to introduce yourself.
Hi, my name's Matilda White. I'm 8 and I've been diagnosed with PANS.
Thank you very much, Tilda. Evie?
Hi, my name's Evie and I've had pandas for 12 years now. I'm 17.
Hello,
Megan?
my name's Megan, and I am 22 years old, and I was diagnosed with PANS in 2010 when I was 7 years old.
I'm Raj Gupta. I'm a paediatric neurology consultant at Birmingham Children's Hospital. I'm a lot older than everybody else, so I won't tell you my age. I got interested in PANS pandas probably about 19 years ago when my first patient was diagnosed with it. We made the diagnosis together with one of the psychiatrists that work at the hospital. And she responded very well to treatment. And ever since then, I've had a passion to try and treat similar children and young people who present in that way, because I can see how beneficial treatments can be.
Hi, everyone. So my name is Ashley, and I'm a doctor like Raj. So I specialize in child psychiatry, and I work in London. And yeah, I think similar to Raj, actually, I think my first patient, which I can still remember doing a case presentation on, was about 19 years ago. So actually, at that time, it was pandas, because actually PANS wasn't even described at that time yet. And yeah, just really fascinated by that case, and since then, have gone on to see several other cases. Good to join you guys.
Hi, I think I'm the last one to say hello. I'm Vicky. I'm Vicky Queralt. I'm a clinical psychologist. I work with children, young people, and families experiencing emotional difficulties. I'm also a mum and have had a lived experience of PANS. I think I'm the last one, so back over to you, Mitch.
Wonderful. Thank you all very much. So that's your wonderful panel of experts for this evening. As you can see, they're all incredibly experienced and will give brilliant insights. So we're going to jump straight into the questions now. So our first one, and this one, Ashley, if you could answer this. Why is PANS pandas sometimes called immune-mediated behavioral change?
Yeah, so it's actually a term that I've only heard fairly recently. I would probably say maybe over the last couple of months only, but I can see it's been gaining in some popularity. I think it's a way to try and separate what's been a bit unknown when it comes to the diagnostic terms of PANS and PANDAS. So some of you might know that when you're trying to explain PANS and PANDAS and you're trying to even read out the whole acronym, isn't it? That's a fairly long name. And it's also an attempt to try and give a description. So as the name suggests, it's got a bit let's say it's immune mediated, so it's something to do with the immune system, and then it's producing a change in behavior. I think that most people would also regard that being a change in, say, mood or your thinking as part of that. So if I gave a parallel example, it's kind of like saying this would be a viral associated skin change. So having chickenpox, for example, is a skin change that's to do with a virus. But actually, if, say, a doctor hadn't really come across chickenpox before and hadn't really understood all the kind of the causes or the descriptions of the diagnosis, then actually saying this is a virus-caused skin change immediately helps them understand, where to start off their search to try and find more answers. So from an immune-mediated behavioral change perspective, that could cover things like more kind of like long-term autoimmune conditions, so things like multiple sclerosis or lupus, some of these conditions some people might have heard of. And then from a psychiatric perspective, we know also that long-term inflammation that affects your immune system might also be associated with certain changes to mood or behavior, so depression, for example, or fatigue. And then lastly, I guess in specific to PANS and PANDAS, I think there's an increasing understanding that actually more sudden change, a more kind of like specific immediate change to your immune system, or your immune system reacting to that change, might then present itself with symptoms like obsessive compulsive symptoms, changes in your eating or changes in your mood, the kind of symptoms that I guess we would associate with PANS and PANDAS.
Wonderful, thank you very much. So next question, and I'm going to start with Megan on this one. How do I explain that I'm currently well, but I might not be at any given point?
Yeah, so like most people who grow up with PANS, I've had to explain this many times, so mostly to like teachers or friends or disability services. And I think it can often be a very difficult part of PANS to explain, because at least I've always felt like the person I was talking to either didn't understand me or either didn't believe me. However, the more times you do explain it, the more comfortable and confident you get at explaining how exactly your PANS affects you. Personally, I found using phrases like I experience flare-ups in my symptoms and then list all my main symptoms that I get works well. I feel like people often understand what a flare-up, what the word flare-up kind of looks like or means. Also emphasizing that it's like a long-term autoimmune condition is good to do as well. So people know that it's not just going away in a few weeks like a cold or a flu, and that they shouldn't be surprised to see you suffer from it again later down the line. Also to people who are more experienced with hearing about medical conditions, maybe like SEN or disability services, I often say that it's relapsing and remitting, which just is a brief way to describe the unpredictable nature of PANS. Another point I'd like to address is that other than the known triggers of PANS like strep A and other illnesses, there are loads of people with PANS, including myself, who don't actually know what triggers their flare-ups a lot of the time. And so I think we shouldn't be afraid to say to someone that actually my health is quite unpredictable, because a lot of the time I don't actually know what triggers it, and it can come on out of nowhere. And there's just not enough research out there at the moment for us to be sure about what triggers my condition. And that's just to basically highlight to someone else how unpredictable your condition can be.
Yeah, absolutely. And Tilda, have you got a slightly younger view on that as well?
I just thought that PANS PANDAS can occur at any time or any age. when you're currently well, as quick as a flash, it can just change, and you're feeling worried, upset, or your symptoms don't seem to be able to stop. For example, my tics I can be fine and happy one moment when all of a sudden my neck or my back is twitching and it's really annoying.
Yeah, absolutely. Thank you both for that. That's always a very difficult point to navigate for anyone with PANS or PANDAS. Moving on to our next question. This one is for Vicky. PANS and PANDAS are paediatric conditions. What is the treatment expectation when we are over 18?
Thanks, Mitch. I'll do my best to answer this one. I think, well, the name paediatric in the PANS and PANDAS refers to children. So in PANS and PANDAS, when you're turning 18, the symptoms don't just magically disappear. So some people first get poorly as children and they're still going to need help as adults. Others might notice symptoms later on. So I'd like to think that the treatment remains the same, whatever it is for that young person, but that what would be different for someone over 18 as opposed to when they're a child is who helps. So someone over 18, they would need to be seen by someone working in an adult service, for example, rather than someone specialising in paediatrics or children's service. And I just think in the UK, I think it can be hard to find the right services that can help, but that doesn't mean anyone should be left without care, and that care should exist regardless of your age. And I think my understanding is that in terms of awareness and treatment for people over 18, charities like the PANS PANDAS UK and the charity Expand, professionals are pushing really hard for better adult pathways, and awareness is growing. So I think anyone, regardless of age, over 18 needs to be listened to and understood and supported.
Yeah, absolutely. And that's a very good point. We will thank the work of PANS PANDAS UK and that for pushing that forward for all of us. Next question. This is a very tough one. I'll get a few people to answer this because of that. What are some good coping techniques for flares? And I think this one will start with Tilda.
For coping with flares, it just depends what you're comfortable with. Like usually having some calm time, watching a quiet movie, going for a relaxing bath, or sometimes just going to bed early. Or you could tell a trusted adult that you are comfortable to talk to, and a calming pet could work. Giving them a hug always calms me down.
Those are all excellent options. Thank you very much. And Evie, could you expand on that a bit?
Yeah, so I find it helpful to take ibuprofen during a flare as it helps me think clearer. I also know that a lot of people use antihistamines in the same way. As for coping strategies, I think it's different based upon each individual's flare. Symptoms, for instance, if you struggle with anxiety like I do, you could try weighted blankets, grounding techniques, and like finding your safe space either in your head or physically in like your bedroom. If you struggle with rage, you could try doing exercise such as star jumps or going for a run. And if you're struggling to sleep, like I have done so much in the past, I recommend using essential oils such as lavender, as it's really relaxing. And I also find magnesium salt baths are helpful before bed. But the best thing that I've actually found is a compression blanket to sleep in. Now, it's also important to remember that it's okay to not be okay when things are difficult. And if you need a day to rest or recover, you shouldn't feel guilty for doing so.
Yeah, absolutely. Those are all very good options, and that's a very good, important point there. That's pretty much covered most of them, I think. But Vicky, is there anything you think you can add to that?
Oh, do you know, Tilda and Evie, you've shared some really wonderful coping strategies, and I love how you both described some really nice sort of soothing elements to help soothe yourself when you're having those flares. So things that you like to do, like when you're cuddling your pet, or finding your safe space, or doing watching something quiet. I think you said, Tilda, watching a movie. They're really good ideas just to allow your body to feel soothed and calm. So like Tilda and Evie said, absolutely engaging in kind of calming, soothing activities, and giving, as Evie said, permission to rest. Do you know, your body and your mind are fighting an illness, and they really need to kind of have time and permission to rest. So it's okay to take breaks, to have to lie down and do something calming so that your body and mind can have a rest. I think just to add to what Evie and Tilda said, I think flares can be absolutely really big and overwhelming, but there are, as Evie and Tilda said, really simple things that can help. And one idea, just to add to that, is to give the flare a name. So you might just call it the flare, or you might want to give it a name, whatever you like. But that way you can remember, when you give it a name, this is something that's happening to me. It isn't who you are. And kind of externalizing it in that way can help you talk about it with others, and it can feel a bit easier to find ways to cope with it. And the other important thing, I think, Tilda said about talking to somebody, if you can stay connected with other people, whether that's someone with your family, like a friend, or someone at school, that you can just keep that connection going, and so that find someone that you can talk to and understand can really help too. I think that's about it.
Brilliant. Thank you so much. Giving it a name, that's an interesting one. I think I'll call mine Barry. Now that loosely links on that having a connection with somebody to our next question. This one for Ashley. My sibling doesn't understand PANS and keeps calling me autistic. Can you explain the difference, please?
Yeah. I guess firstly, it kind of depends on how old your sibling is, and you'll know best how to communicate with them. But let me give you some principles. So, I guess autism is what's called a neurodevelopmental condition. So it's thought that there's a interaction between genetic factors and as you're growing quite early on. And generally, you should be able to spot signs of it before age 4. And then when you start showing the features of autism, so difficulties with social communication, so how you talk or use your body to communicate with others, difficulties with social interaction, so making friendships or keeping those friendships, mixing in groups and understanding how to kind of do to and fro conversations, and then other features like having more repetitive behaviors or having sensory issues. So when you start having all those kind of features, they tend to be stable throughout your life. They might change a little bit because of the ways that you get support or how others around you kind of respond to you. Whereas with PANS, I suppose from a course perspective, it's taught that this is something that occurs when there's some kind of response of your immune system, like we said earlier on in the webinar. And from that kind of more sudden point, you're getting a range of other features, some of which kind of overlap with autism, but I guess the ones that stand out more are obsessive thinking and compulsive behaviors, changes to your kind of food eating patterns, so you kind of might be more restricted in how you're eating. There might be mood symptoms, which might look like autism symptoms, but also kind of other body symptoms, so kind of changes to urination, for example. So there's a bit of a difference around the symptoms themselves, and then the course of it, as you've heard everyone really kind of comment, might be a bit more of a stop-start kind of course. So you might get flares, like Megan was saying, you might be relapsing or remitting, which is very different from autism. So I guess those are the principles, and I guess you're going to have to just kind of key to that to you know what your sibling is saying and what stage do they want to try and understand the differences between the two.
Brilliant, thank you so much for that. And our young people have really been on a roll with these deep, interesting questions, because here's another one, this one for Raj. There are a lot of autoimmune conditions in my family. Does that make it more likely someone will have PANDAS? Will I pass it on to my children?
These are excellent questions indeed, and not easy ones to answer. So I think the answer to this is yes. So basically, there is evidence to sort of suggest that a personal or family history of autoimmune conditions is a potential risk factor for having PANS or PANDAS. As you know, autoimmune conditions is that your immune system overreacts and starts attacking healthy cells as well. And we believe that that is the way that PANS PANDAS also happens. That basically your immune system fights a response to an infection or other trigger that causes inflammation, and then basically your immune system also attacks healthy cells as well, and then causes the symptoms that happen with PANS and PANDAS. So there are some similarities in the way that these conditions behave. And there have been some studies to sort of suggest that people who have PANS PANDAS are more likely to also have other autoimmune conditions. And we know that autoimmune conditions run in families. But my view is that with autoimmune conditions, you need to have more than just a genetic predisposition. Something else probably happens alongside, which then causes you to develop an illness and develop symptoms. So just because a parent, for instance, may have autoimmune conditions does not necessarily mean that their child will develop those autoimmune conditions, and does not necessarily mean that their child is going to develop PANS and PANDAS going forwards. I think there's still lots to learn about why PANS PANDAS happens, and I think it goes beyond genetics. I think there are other factors involved, but we still got a lot to learn. So hopefully, when we next have a meeting like this, we'll have some more answers.
Thank you so much for that one. Moving on to our next question. How likely is it symptoms carry on into adulthood? And will I still get flares? An important question that I myself had as I was going off to uni. Megan, would you like to start with this one?
Yeah. So this is a hard question as well. I think like Vicky touched on earlier, it depends on the person completely, and everyone's PANS journey and recovery looks different. Usually symptoms are supposed to subside as you get older and enter adolescence or young adulthood. But sometimes people do experience recurring symptoms. If I'm talking about my personal experience, I have still had PANS flare-ups or flares since I've become an adult. And since I moved away from home and started university, which was 4 years ago. However, they have been a lot fewer and further between, and a lot more manageable compared to when I was younger. And I think as well as the biological aspect of my immune system maturing, I think what's really helped me or my experience going into adulthood is learning how to monitor and manage my PANS by myself. For when I do experience the occasional recurrence of symptoms. It was a really hard transition personally, especially for the first few years after moving away from home, because I think like most people with PANS, for my whole life, it was my mum who would look after me. And like, for example, she would know when I was having symptoms before I even knew myself. So it was a very big learning curve, and there were a lot of ups and downs. But eventually you learn kind of what works best for you and keeps yourself healthy. I think for me personally, just like a few simple things I know it's quite annoying to hear because everyone says this, but prioritizing sleep and like learning how to say no to things when I feel like my body's a bit overwhelmed or like drained. And also exercising has really helped me. Like, for example, I started going on runs a couple years ago to help me clear my head, and I just found that it's really helped me. So yeah, but everyone is different, and it is a matter of learning what works best for you.
Yeah, those are all brilliant points, and I can second all of those actually from my experience too. Ashley, is there anything you can add to that for us?
I don't think I can really add to Megan's excellent answer. Also because I guess we haven't really had much time to follow up, and certainly within the research, be able to kind of see more long-term follow-ups for children and young people, who have PANS. So the little research that's there would suggest that, like Megan said, there is a group of children that appear to get better, as they get into young adulthood. So I think that's important to note. But yes, equally, I think there's lots of reports of young people as they go into adulthood that they continue to have at least part of their symptoms, including the flares like we've just been addressing. So I think, be keen that we try and think of how we try and get that documented in research also, because then that means that we can understand that better, and then we can have better answers that might be able to benefit more people.
Yeah, absolutely. That would be what we're looking to do in the future. My last major flare-up, for instance, was just a year ago. So it does unfortunately still happen, but it's great to see people like Megan coping so well with that change. So thank you both for that. Following on from that, back to Megan again. Is this going to be what my life is like forever? A really tough question, but if you can answer that for us, please.
Okay. I know that when you're experiencing a flare-up, it can feel like very hopeless. At least for me, like picturing a future when you're well again can be really difficult, both for the person experiencing PANS and the surrounding family members. But how you are, I think it's just important to say that how you are when you have your PANS symptoms or flares like doesn't define you, and it definitely won't be what your life will be like forever, and it's just important to try reminding yourself of that when you can, like as often as you can as well. I think there are so many people who have outgrown their PANS, and it's always helped me to stay hopeful and optimistic about the future, just knowing that that's a possibility.
Brilliant, thank you. And in the same vein, we'll stay with you for now, and then Evie, I'll get you to follow up on this next question as well. In the future, will PANS or PANDAS hold me back from getting a job?
So as you become older and your flare-ups become more manageable, I don't believe that PANS or PANDAS will hold you back from getting a job. I remember when I was told by family members and teachers that maybe I should reconsider trying to become a doctor, even though it was something I really wanted to do. And like there was a point in time where my parents thought that I would have to live at home with them for the rest of my life, with them like taking care of me. So at times it really did not look very likely that I would be able to have a steady job, let alone one in like healthcare. But now having my health improved so much since being a child and since being at university as well in the past 4 years, I was able to pursue the job that I wanted to do. And another thing I think is good to be reminded of is that I think something I've already said, but everyone's journey is different. So if you do need to retake school years or exams or take years out of education, just to make sure that you're healthy, then that's completely fine. And it's just a really important thing to do for yourself. Like, you shouldn't compare your journey to anyone else's, because everyone has different things going on in their lives at different points. So my answer to that question is that I don't think PANS or PANDAS will hold you back from entering the workforce, especially if it is managed well. And if there are any exceptional circumstances that trigger symptoms later down the line, that this is treated and you can get back to living healthy again.
Yeah, that's brilliant. And with that point of everyone's journey is different. Evie, can you tell us a bit about yours on both those last two questions? You know, is this what life is like forever, and in the job aspect as well?
Yeah, it does depend on the severity of each individual's symptoms. I do think children that are treated early, they generally go on to make a full recovery and full independent adult lives. I think it's important to remain hopeful that recovery is possible, and if not full recovery, PANS PANDAS children can make huge improvements. For example, I missed 2 years of primary school and then attended a specialist secondary school. Nobody thought that I'd sit my GCSEs, let alone pass them all. So it just shows that improvements are possible. Now, getting a job isn't going to be easy for me. Right now I'm in college. Despite my PANS PANDA symptoms still being quite bad, I do make it in every day, which if you would have told 9-year-old Evie that, she wouldn't have believed you. Now, my OCD is quite extreme and prohibits me from carrying out everyday tasks, and it can be mentally and physically draining. So right now a job isn't on the cards, or certainly not a full-time job, but hopefully in the future things could change.
Brilliant. Thank you both very much. Yeah, it's always difficult looking at your future when it's so uncertain and you're feeling so alone sometimes in your symptoms. And personally, I know that it can be quite dark when I was going through it. But, you know, people like me, people like Evie and Megan, we've all still managed to do what we want with our lives. I'm working in one of the most dangerous sectors in the UK, as possibly with some dangerous symptoms still, it can be done. And we're all here to show, particularly all our younger people out there, that, you know, we're doing it, so why can't you? So thank you both for your insights. Moving on, going to Raj for our next question. Why isn't IVIG offered as standard treatment in the UK?
So another good question. So I know that many of you will be aware that in other countries, particularly the USA, immunoglobulins seem to be the go-to treatment for PANS and PANDAS. In the UK, there are challenges with regards to supply and shortages. And therefore, in the NHS, there have been immunoglobulin assessment panels set up. And every time we consider immunoglobulins for whatever condition, we have to apply to that panel, our regional panel, to get their permission. And these panels are actually very strict now in the criteria that they use to decide whether or not we can give immunoglobulins. They basically look at all the evidence that's available. And often they will turn down immunoglobulins for conditions that we traditionally treated with immunoglobulins. And unfortunately, they feel that the evidence base for immunoglobulins in PANS PANDAS is very limited, and therefore the tendency is to reject immunoglobulins in the NHS for treating PANS and PANDAS. Another thing to also remember is that immunoglobulins are blood products, so they do carry risks. So you shouldn't be giving immunoglobulins lightly, because in theory you can pass on bloodborne disorders through IVIG. Now, I don't think you should be disheartened, because I think one thing in the UK that we've now managed to do is utilize other treatments that are available for our patients with PANS PANDAS. So we have a lot more experience compared to the US in using antibiotics, non-steroidal anti-inflammatory drugs, and steroids, and even maybe antihistamines. And in my experience, and I've got a lot of experience now dealing with children, young people, and adults with PANS PANDAS, they do show good response to those other treatments. So it's not that you can only IVIG is going to work. We've demonstrated in the UK, at least, that other treatments can also be very helpful indeed. So don't be disheartened just because you can't get IVIG on the NHS.
Yeah, that's brilliant. Thank you so much. Our next question is, why do statistics say more boys than girls have PANS PANDAS, but I've only ever met girls with it? Vicky, if you're okay to try and tackle that one for us.
I'll certainly give it a go. It might just be a short one, response. I mean, it's an interesting observation, but I think it just reflects maybe who that person knows rather than an actual gender difference. It's my understanding that we don't actually know for sure yet what the gender mix is, and there haven't been any like strong studies that have counted accurately what the gender ratio is. There's a surveillance study underway in the UK right now, which will help to get some of those numbers, but can't, you know, to try and get some more accuracy right. But right now, I don't think we have any evidence as such to say whether it's more girls, more boys, you know, we just don't know. So I think we just have to wait and watch and see what happens with the research.
Absolutely. And for that young person who asked that question, hi, I'm Mitch. I'm a boy and I have it. So there you go. That's sorted that one out for you. Maybe if Tilda could just give you guys any experience of people you've met with PANS PANDAS. What's it like meeting other people with PANS PANDAS? Obviously, you're all youth board members, so you've got that experience. But yeah, Tilda, if you want to have a go.
I've only really ever met people with PANS PANDAS online, but it shows that lots of different types of people can get it.
Yeah, absolutely. Thank you. Evie?
I've met a lot of people. We've actually met up in person, a little group of us, which was nice. After speaking online for a while, I think it's important to connect with others because they've got similar experiences to you, and unlike peers at home, they get it.
Yeah, absolutely. Megan?
I'm the same as Tilda. I've only met people with PANS PANDAS online, and yeah, I think this is like a great resource to have, this like youth board and even just this conference as well. I think it will allow a lot other people to also meet people with PANS and PANDAS online as well.
Yeah, absolutely. I only met anyone online, but through the youth board, so that's been great for me. But we'll come back to that later on. For now, our next question: what do you think of tonsillosectomies? I can't say that word. As an intervention for people with PANDAS, Raj, I'm assuming you can say that word if you recognise what I was attempting.
No, a good try though, Mitch. So tonsillectomies. That's the one. So many years ago, I'm sure even some of the parents or grandparents who might be on the meeting with us today, they'll remember that tonsillectomies were done very frequently, even if a child or young person had only had 1 or 2 bouts of tonsillitis. However, ENT surgeons, so ear, nose and throat surgeons, are now following much stricter criteria because the tonsils have an important role in helping to manage infections and immunity. So they no longer just whip the tonsils out if you've had 1 or 2 episodes of tonsillitis. And basically, they want to see recurrent bouts of tonsillitis. I think it's about 6 in a year at least, and significant tonsillitis with temperature before they may consider tonsillectomy. So coming to your question now about whether tonsillectomy should be an option in pandas, my view is that if you're having bouts of tonsillitis and you've been able to demonstrate that tonsillitis is your trigger for your pandas symptoms, then I think it is actually very reasonable to be referred to an ear, nose, throat consultant for consideration of a tonsillectomy. And I have referred a number of my patients where they have flares in symptoms due to tonsillitis to my ENT colleagues, and they have actually done tonsillectomies. And for those specific patients, the tonsillectomies have actually been very helpful in reducing the number of flares.
Brilliant. Thank you so much for that. I'm recovering my appalling pronunciation. Next question, we're going to stay with you, Raj. How common are seizures in people with PANS and PANDAS?
Okay, so I think first of all, we need to talk about what a seizure is. And seizures can be of many different types. And we tend to sort of split them into 2 broad categories, i.e. epileptic seizures, so seizures which are unusual movements triggered by abnormal electrical activity on the brain, and non-epileptic seizures, where basically you may have similar type movements, but they're not triggered by abnormal activity on the brain. So in my experience of PANS PANDAS patients, yes, you can have seizures. Not every patient. I think probably less than 5% will have seizures. But in those 5%, the majority of cases, these are non-epileptic seizures. So basically, these are unusual episodes which look like epileptic seizures but aren't epileptic because they're not triggered by abnormal activity on the brain. Now, they are still very much real episodes. So they're not made up or fake, okay? It is just that the trigger is something else. And the trigger may be things like emotion, it may be anxiety. And it is actually potentially a sort of a coping mechanism for other things that are happening in that child, young person, or adult at that time. But the management is very much different from epileptic seizures. So you wouldn't start these people on anti-seizure medications. What you probably would have to do is think about psychological support and actually treating the underlying PANS, PANDAS with the appropriate treatments. So real non-epileptic seizures are very real, okay? So they're not made up or fake. And I think sometimes health professionals give the impression that these are made up, and they shouldn't do. Okay, and that can be very disheartening for the patients, but also their families, all right? These are basically real episodes, but they need to be treated differently to epileptic seizures.
Brilliant. Thank you for clearing that up for us. Next question, and this is going back to our experts with by experience. If you have one of these conditions, PANS or PANDAS, who can you go to? Who can you talk to? What sort of processes would you go through? We'll start with Tilda for this one, please.
For me, it could be a trusted adult or guardian, someone who you really feel you can talk to, but it doesn't have to be someone in your family. It can be friends or teachers as well.
Yeah, that's brilliant. Thank you very much. And Evie, anything you can expand on that for us?
Yeah, I agree with Tilda. Talking to someone that you trust is certainly very important. I think it helps increase their understanding of what you're going through, while also reducing your anxiety because you're sharing it. Additionally, you could speak to a medical professional and try to explain your symptoms. The charity actually produced some really informative leaflets that you could print off and take to appointments. I think there's a GP specific one, a CAMS practitioner one, and a teacher's one. Now, unfortunately, not many doctors are actually aware and have the ability to treat this condition, which means finding help can be difficult. I am one of the children who was actually lucky enough to receive treatment from Professor Gupta, who's here today. I received IVIG and it was actually life-changing. Now, sometimes finding help for specific symptoms is actually easier than finding help for PANS PANDAS itself. For example, if you get loads of earaches and it's the cause of your flares, then you should go down the ENT route. Now, a lot of families and children, they also seek help from alternative sources outside of traditional medicines. This includes functional medicine practitioners, nutritionalists, and Senkos to keep them, and you should also include your Senkos at school to keep them informed on important information about you or your child.
Yeah, absolutely. Thank you. And I think that's the very important point there is always about this trust. You know, find those people who you trust and make sure they know, they understand, and you can go from there. So thank you both for that. Moving on now to our final question, and this one will be going to everyone in turn, and it is quite a deep and meaningful one, but a lovely one to end on. What makes you feel hopeful right now? I'm going to start with our medical professionals first. So let's start with Vicky.
Hi, just to clarify, I'm not a medical profession, but I am a clinical psychologist. I'll leave that one to Prof. Gupta and Dr. Liu. But what makes me feel hopeful? I feel hopeful because I think awareness is really growing. I think this week has been amazing that the PANS PANDAS UK charity has put this big online conference on, and we've got lots of different professionals who've come to speak, and it's been really well attended by the community members about how to support children and families with PANS and PANDAS. I think there was someone that connected with me on LinkedIn that said that they were going to listen all the way over from Australia. So that's the other side of the world, which is just brilliant. Having so many people together and focusing on ways to help shows me that things are changing. And I think more awareness means quicker recognition, more understanding, and then more choices for support. So I'm really hopeful for that. So thank you for this week for the charity.
Brilliant. Thank you, Vicky. Entourage.
Yeah, so I mean, I echo what Vicky said. I think what makes me most helpful is the fact that children, young people, and adults like yourselves, their families, and PANS PANDAS UK have made a massive difference in increasing the awareness of PANS PANDAS and the impact that it has not just on the individual, but the whole family. And that has actually then helped professionals like myself to feel that we should be actually fighting to also treat patients and young people, children, young people, and adults with PANS PANDAS and support the families. And the good work of PANS PANDAS UK has actually meant that other stakeholders, including the Royal College of Psychiatrists, the Royal College of Paediatric Child Health, and the Royal College of General Practitioners, and many others, have actually come together to sort of develop guidelines, to start a surveillance study, to develop guidelines in education. So a lot of good work is being done behind the scenes. So if you had asked me maybe 5 years ago what the future for our children, young people, and adults with PANS PANDAS was going to be, I wouldn't have been as optimistic as I am now. And you know, I think a lot of credit has to go down to you all for the position that we're in now, but also PANS PANDAS UK. They're a driving force in this, and not just in the UK, but also internationally.
Yes, absolutely. Ashley, you're up next.
Sure. So yeah, so a slight echo. So I guess the first thing is that, yes, I think awareness has grown. I think it's fantastic that it's culminated in events like the conference this week. But I guess the thing I would kind of focus is that I think it's so wonderful that the yourself, Mitch, Tilda, Megan, and Evie have been part of this panel. So I think in a lot of other areas of medicine that I'm involved with, I think that when young people and children and young adults are able to speak up and advocate for that, I think that's a really powerful voice. And I think it's fantastic that you guys have been able to do that for this event. And I know that there are lots of other young people that have also really contributed to raising awareness through PPUK. The second, just to expand on what Raj was saying there. So I think it's pretty landmark that we've got all the professionals across different disciplines. So, so my college, Raj's college, but also other organizations like nursing and doctors that deal with infectious diseases and immunology, coming together. Because actually, again, having done quite a lot of work with policy amongst in medicine, it is quite a feat to bring all of that together. So I think that speaks to people and professionals recognizing the real need, but also that actually this is an area that we can only produce something meaningful if we did that together and collaborated together. And then the last bit was around research. So I think we really highlighted throughout this meeting that it's important that we get better with research, because I think that helps represent people better, helps us understand, helps professionals understand how to plan better treatments, plan better responses, plan better supports. And I think I'm really excited that we're moving ahead with some of these projects locally, but also internationally. We're seeing quite quite sophisticated research actually being planned and being carried out. And I think that can only really benefit, the whole community in years to come.
Brilliant. Thank you very much for that. So moving on to our experts by experience. Megan, can you start us off, please?
I think what makes me hopeful, I think very similar to the other medical professionals, is that the fact that every day I'm hearing more and more about people from around the world who are getting involved in spreading awareness, raising money for PANS PANDAS charities, particularly PANS PANDAS UK, and also all of this like any performing of research about PANS is always really exciting to hear about, particularly the current development of the guidelines in the UK, I think is really exciting. And it's just really promising for children who are diagnosed with it in the future. So yeah.
Brilliant. Thank you very much. Evie?
Along with what's already been said, I do think what makes me hopeful is the amount of people that are raising awareness now. There's people doing fundraising events and doing charity conferences, taking time out of their own day for us, which is very hopeful and inspiring. What also makes me hopeful is the fact that I know that I've been through worse and that there's always brighter days ahead. Things do get better, even though it doesn't feel like it at times. I'm living proof that it does get better. I also find it very inspiring seeing other people who have suffered, and I like to hear their stories because it makes me feel hopeful about mine.
Yeah, brilliant. Thank you so much. And to finish our questions off, I've left you, Tilda, till last because I think this is possibly your view is the most important on this. You're the youngest member here. What makes you feel hopeful right now?
Probably knowing that somebody, even if I can't see them, has got my back. It doesn't really matter who, and the fact that people are taking more notice of the diagnosis PANS PANDAS is really encouraging